Good afternoon, students. Good afternoon. Good afternoon, beta. Good afternoon. Good afternoon, everyone. I hope the link is live and you guys can see me and hear me clearly. Just waiting for your confirmation, waiting for all of you to join. Hello, everyone. Hello, everyone. Hello, Madhav. Good morning. Madhav, good morning. Good morning, all of you, beta. Good morning to all of you. Just allow us 2-3 minutes more time for everybody to join. Yes, beta. Waiting for the others to join, beta. Good morning to all of you. Good morning, everyone. Yes, Madhav, the questions were pretty easy actually. Yes, biochemistry were having good questions. Yes, beta. Himani, good morning. Good afternoon to everyone. Good morning. Good afternoon. Yes, this time there was Vishnu. Good afternoon, beta. Vishnu. Good afternoon, beta. Good afternoon to all of you. Just give us 2 minutes more to others to join as well. What happened to CR7? Why that emoji? I hope the exam went well, beta. Yesterday paper 1 was quite easy, straightforward, most of the questions. Right, beta? Good noon, Manish. Abdullah. Yes, easy questions. Direct questions were asked, beta, this time. I'm happy that all of you have got the questions common. That is the main idea, beta. This is just a licensing exam, and from the core of our heart, we always pray that all of you pass, my dear friends. Yeah, easy questions, easy questions. Few of them were having little bit twists that we will discuss while we are having those session. So just waiting 1 more minute. Exactly at 1:05 we will start. I hope the others are also joining. Let us have 1 more minute for others to join, beta. Yes, Saurabh Chaudhary. Yes, beta. Exactly that had happened, beta. That paper one was actually quite easy, straightforward. Not much of brainstormers were there, but paper two, although was more of one-liners, but still it was pretty difficult as well. That's the feedback. Yes, paper two was indeed little bit tough, although one-liners, but yes, questions were little bit unexpected. Yes, that's the feedback that we had got, beta. So yes, so let us start. Yeah, the pattern was neither clinical nor one-liners. Yes, beta. In the paper two, that was a mixed bag of those. So let's try to have this session at least for biochemistry. I believe all of you, my dear friends, would have got the answers correct. Talking about biochemistry notes from the missed side, we had almost all the questions that were common that was given in the yesterday's exam. So I believe all of you who had attended the yesterday's exam, as far as biochemistry is concerned, as far as paper one is concerned, you would be definitely scoring very, very high marks, my dear friends. No question about that. I'm pretty sure that all of you will be scoring needed marks in your paper one, and with optimum marks in your paper 2, all of you shall be coming out with flying colors when the results are out just 1 month's time from now. So with this positive attitude, let us try to discuss the questions that were asked from biochemistry. Now, talking about the first question, my dear friends, all of you will remember that there was a direct question on von Geek disease. In missed classes, we had discussed von Geek disease in the form of clinical scenarios as well, how the presentation happens. But this time, my dear friends, it was just basically asked as a simple one-liner question: what is the enzyme deficiency? So, waiting for the answers, my dear friends. Waiting for the answers. Answer to the question number one, my dear friends. Answer to the question number one. I believe all of you that had attended yesterday's exam had got this one correct. No confusion, my dear friends. The answer to this question was glucose 6 phosphatase. We had discussed this multiple times in our missed classes, as well as we had discussed it in the form of clinical scenario. Even it would have been asked as a clinical type of questions. I'm sure all of you would have got this one correct as well, right? So let's clap for all of you, my dear friends, for getting this one correct. First one, basic answer, glucose 6 phosphatase. Glucose 6 phosphate dehydrogenase deficiency is the most common cause of hemolytic anemia in India, right? Glucokinase deficiency, glycogen synthase. Glucokinase is the enzyme for glycolysis. Glycogen synthase is the enzyme for glycogenesis. So here, von Geek disease, pathway, glycogenolysis. Last step of that, glucose 6 phosphatase. Yes, all of you would have got this one correct. Moving to the second question. Let us try to see the easy questions first, my dear friends. Waiting for the answers. Exclusively performed in cytoplasm. Few students gave me a feedback that this was exclusively in cytoplasm, or few of them has also given feedback like all of the following are seen in mitochondria except. No matter how do we frame the question, basic idea is cytosol, which is the answer. Cytosol, which is the answer, my dear friends. Yes, Benazir. Benazir, yes. Yes. Benazir, yes. Glycolysis. Yes, my dear friends. The answer to this question, glycolysis. I believe all of you would have got this one answers correct. Let me also thank all the students who has taken sincere efforts in helping me with the recall MCQs so that we can actually come in front of you guys and share our views as well as our thoughts as far as MCQs are concerned. So let me clap here as well as congratulate all the students of MIST who had actually helped me in framing the questions. Although some of the questions, the language, it might get little bit different than what you would have seen in your computer screen beta, but please try to understand, at least we have tried to keep the essence of that MCQ intact. The main crux of the story was we have tried to keep it intact. So the answer to this question is glycolysis, my dear friends. Now let me just help you out here beta. This gluconeogenesis, we have discussed this. This is a mnemonic called PUBG. So gluconeogenesis is actually partly seen in cytosol as well as is in mitochondria both. Talking about glycogenolysis, 90% of glycogenolysis is actually done within the cytosol, my dear friends. However, the last step where we require glucose 6 phosphatase, just now we have heard the enzyme name for which there is a deficiency that leads to glucose 6 phosphatase deficiency, leads to von Geek. Last MCQ, that enzyme glucose 6 phosphatase is actually present in microsomes, my dear friends. So please try to understand glycogenolysis, although major part is done in the cytosol, but 10% last wala jo step hai beta, last step is done in the microsomes, right? Fatty acid breakdown, we all know it is done in the mitochondrial matrix, my dear friends. But if they would have asked fatty acid synthesis, then the answer could have been cytosol as well. Please remember, my dear friends, synthesis, this is actually seen in cytosol. Breakdown was asked, many students has confirmed that sir breakdown उन्होंने पूछा था, so basically this is seen in the mitochondria. So exclusively performed, only site required, answer will be glycolysis, my dear friends. Glycolysis. Oh, TCA cycle was there also in the option. One feedback has come, my dear friends. Thank you for your suggestion, my dear friends. So even TCA cycle, if you say, it is done in the mitochondrial matrix. Yes, my dear friends, some options might be little bit different, but we have tried to keep the essence intact as for our best knowledge and best efforts, my dear friends. Within a day, we are actually coming out live. So please forgive me for if there is any disparity in the MCQs, but we will try to go by your suggestion as well. Yes, cytoplasm. Now, Let us see this question, my dear friends. Let us see this question, my dear friends. The lines might be little bit less, but I have tried to put more essence into it. So I hope that the crux of the story, basically we have tried to keep it intact. Basically from this MCQ, the point that you have to focus, that all the students has confirmed that there was swelling around the knee joint, patient had present with knee joint pain, arthrocentesis was done, and it has revealed needle shaped crystals with negative birefringence. These three lines has been told by all the students, my dear friends. This history that I have just framed, it might be little bit different, but these three were there. Yes, answer to this. Yes, my dear friends. Answer to this question is gout. Yes, Aman, Benasir, Prashant. Thank you so much, my dear friends. You guys have all answered this question correctly, beta. The answer is gout. Yes, right, beta. Right, beta. Let me just quickly help you out. Let me just quickly help you out, beta. Let me just quickly help you out. The answer to this question was gout. Many of you might have thought this case as a pseudo gout, because pseudo gout was also given as the option, and we know pseudo gout basically starts from knee joint. But please try to understand, my dear friends, we had also discussed during our classes at MIST that we also have something called as chronic gout. I told you, acute gout cases, they will always give you a complaint that the pain is originating from our distal region. Please try to understand, my dear friends. The pain will be mainly localized around the first metatarsophalangeal joint or our great toe. And accumulation of uric acid crystals, monosodium urate crystals, is called as podagra. That is podagra. But in this case, they have mentioned that the pain is mainly localized around knee joint. And knee joint is one of the common site for chronic gout patients, where we do see hyperuricemia as well. You might see some crystals. So in this case, it was actually a case of chronic gout. I hope all of you would have got this answer correct, my dear friends. Benasir, actually, I had asked this feedback about many students, but they had confirmed that it was actually around the knee joint beta. That's why there was a confusion. If they would have answered or given metatarsophalangeal joint, I mean the first one, then straightforward, the answer will also be gout. In any case, you guys would have definitely got the answers correct, my dear friends. The case is actually gout over here, right? Hope this question was answered by all of you, and all of you would have got this answer correct, my dear friends. So please try to follow. Whether they have asked master first metatarsophalangeal joint, that is there, answer gout. Chronic gout also knee joint, but you get some needle shaped crystals with negative birefringence. This is the main key word, my dear friends. I'm highlighting it here better. Needle shaped crystals, that is not seen in pseudogout. Pseudogout shapes are actually rhombic shapes. And in case of negative birefringence, please try to understand, my dear friends, in case of pseudogout, we have positive birefringence. We had discussed this. Pseudogout, positive birefringence, gout, negative birefringence, right? Important point. Try to focus on this, beta. Yes, just now we have discussed beta, it cannot be pseudo gout. Pseudo gout में क्या होता है beta? The shape of the crystals are actually rhombic plates. Rhombus की तरह दिखता है ना बेटा? Rhombus. यहाँ पर है needle shaped. And another one is pseudo gout, positive birefringence. This one was mentioned as negative birefringence. So even though there is a confusion about the site, whether first metatarsophalangeal joint or knee joint pointing towards chronic gout, or first metatarsophalangeal joint pointing towards acute gout, in any cases answer will be gout, my dear friends. I hope all of you would have got this answer correct, my dear friends. So let's clap for all of you, those of you have got this answer correct, my dear friends. Now coming to the fourth question, another straightforward question. I believe all of you would have got this correct. Waiting for the answer, waiting for the answer, waiting for the answer beta. Waiting for the answers beta. Yeah, just holding on. Anti-atherogenic compound. Anti-atherogenic compound, my dear friends. Adil, if it was positive birefringence, then what was the shape we have to look for? Because the shape will be in rhombic plates. You don't get needle shaped crystals anywhere in your pseudo gout cases. So please try to understand, it is most likely not pseudo gout. I believe many of the students has confirmed it was the negative birefringence, right? So waiting for this answer, my dear friends. Yes, 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 yes. All of you, yes. The answer to this question, my dear friends, it will be omega 3 fatty acid, most effective anti-atherogenic compound out of this list. Options might be a little bit different. Many of you are answering this question as B beta, but please try to understand, no, it is not B. Most effective anti-atherogenic compound is actually our omega 3 fatty acid beta. It is not the omega 6. It is not the omega 6. Please try to understand, omega 3 fatty acid actually they do not lower LDL, HDL, or total cholesterol, but they are actually cardioprotective in nature. Please try to understand, my dear friends. Important point to be noted बेटा. Omega 3 fatty acid ये क्या कर सकते हैं बेटा, ये cannot lower the LDL cholesterol, HDL cholesterol or total cholesterol for say, but they are having huge amount of cardioprotective activity. Whereas if we talk about this omega 6 fatty acid है ना बेटा, this omega 6 fatty acids actually they lower LDL, total cholesterol as well as HDL. So please try to understand, my dear friends, as omega 6 fatty acids by mistake they are also lowering this HDL. That's why they are not that good. They are doing two things good: LDL lowering, total cholesterol lowering. This is good, but unfortunately they are also lowering the HDL, that is a good cholesterol, my dear friends. That's why, although none of this can be decreased by the omega 3 fatty acid, but as they are having the cardioprotective nature, they are considered as the most anti-atherogenic compound out of this list. Omega 6, omega 9 also we do see in our human body. Omega 12 sometimes we see, it is very rare, but mainly three primary form that we have is 3, 6 and 9. 3 is the most important one. Important point, try to focus here beta. Try to focus here beta, important point. Yes, hope this was correct. Yes, omega 3, omega 3. I hope all of you have got this one correct. Another straightforward question. This time examiners were very much lenient to give you this sort of direct questions, my dear friends. All of you would have got this one correct. Yes, waiting for the answer to the question number 5 beta. Question number 5, melanin. Yes, waiting. Answers, answers. Yes, 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 my dear friends. Yes, yes, all of you have got this one correct, my dear friends. All of you have got this one correct. Great beta, great. Tyrosine, melanin directly. Tryptophan gives you melatonin. Tyrosine, melanin, right? Methionine gives you SAM. Cysteine gives you all those glutathione, taurine, all those important things, right? So tyrosine, I believe all of you would have got this one question correct, right beta? Hope this session was helpful for you. Please try to understand this. Now coming to this question, next question, question number 6. Next question, question number 6. Next question beta, please try to focus on this beta. The image might have been given some other image, but the essence of the image is here, and I am waiting for the answer. Waiting for the answer. SAM, it was not the methionine beta. Methionine gives you SAM. Sam, your name Sam. Methionine gives you Sam. Yes. Now, waiting for the answer. Yes, yes, all of you have answered this question correct, my dear friends. This is particularly due to copper deposition. I saw Ankita. Ankita, you have answered no, beta. This is not iron deposition, beta. This is not iron deposition, although the color might look like close to iron, golden brown, or but this is actually a picture of the KF ring beta. Let me just make it bigger and highlight it one more time beta. Please try to look at the arrow. This is actually the KF ring, Kasher-Fleischer's ring. This is one of the late complications of patients suffering from Wilson's disease, where we have deficiency of ceruloplasmin, but we have actually excess of copper in our body. So please try to understand, my dear friends, the answer to this question actually will be this copper deposition. Many students has also told that they had also given some copper deficiency also in the option, but please try to understand this is due to copper deposition, and this sort of things are also part of chalcosis. This was also part of chalcosis. All of this we had discussed during our classes of Miss, my dear friends. Okay, phenylalanine was also there in one of the option. Okay, Wilson disease, ATP7 B gene mutation. This time they asked about the deposition of the copper. Copper is considered as a foreign body whenever it is deposited in our eyes. If it is deposited in the Decimet's membrane of our cornea, then we have this basically KF ring. If it is deposited in the lens, we have those sunflower type of cataract. So few students messaged me about sunflower cataract. Few students told about this actually as the KF ring. So any cases answer will be copper deposition, right beta? Hope you have got this one correct. Okay, Benasir, thank you for the feedback that apart from this image there was also mention of liver disease was mentioned in the question. Okay, so hepatolenticular degeneration starts with the problems in the liver, hepatocellular degeneration. Yes beta, having important neurological manifestation as well as this liver problem. Adil, thank you so much beta to give the exact feedback about this question. There was a mention of neurological manifestations as well as liver problems. With this image you can never go wrong. Wilson's disease, my dear friends, all of you would have got this answer correct beta. All of you would have got these answers correct. Sunflower cataract, Salim, or KF ring, whatever way the question was asked. I hope all of you have got this one correct, right? Not sure about this question or this image, but students has messaged me multiple feedbacks that there was a image given and they had asked about what sort of protein energy malnutrition. I'm not sure about this exact image or this particular question. Waiting for your feedback, waiting for the answers beta. I hope all of you would have got this answer correct. I hope all of you would have got this answer correct, my dear friends. Yes, beta. Yes. Yes, B. Yes, Zafar. Thank you so much, beta. Yes, the answer to this question, all of you would have got this one correct. Kwashiorkor. This is actually those fat sugar baby. Please try to understand fat sugar baby will be actually swelling up. They will look bulky, but they are actually suffering from isolated protein deficiency. In marasmus you can actually count their ribs because there is severe emaciation. So please try to understand, my dear friends. This is the picture of kwashiorkor. I hope they had given this sort of image, protein deficiency or something like that. Kwashiorkor asked, I don't know in which form. This is actually, I did not get enough feedback beta, either image or they would have asked isolated protein deficiency, something like that, right? So hope you have got this one correct. Moving to the next question, my dear friends. Many students had discussed this question that I hope I have also narrowed down to the right options as well. So please try to understand. Let us target this question beta. Let us target this question. Yes, kwashiorkor protein deficiency beta. Protein deficiency was there in the option. So basically they had asked about which deficiency, maybe carbohydrate with mixed bag or isolated protein, something like that, right? Essence, kwashiorkor was asked. Yes. So waiting for the answer to this question. Raj, you have answered the question correctly, beta. Raj, you have answered the question correctly. Yes, the answer to this question. I'm waiting for the others also to answer. Waiting for the others also for the answer beta. Waiting for the others. Yes, waiting for the others. Ramesh, Saddam, all of you are actually answering this question as A beta. Yes, Tom Cruise. Yes, my dear friends. As of now, I saw two right answers, my dear friends. The answer to this question is RNA editing. RNA editing. Please try to understand. This was a question that was asked from lipoproteins chapter with a punch from the molecular biology section. Actually, in the classes of MIST, only in some selected centers I had taught this. I now realize that I should have taught all of this or this hi-fi little bit fundas in all the batches. So answer to this question actually was RNA editing. Few students had definitely answered this correct. Actually, please try to understand that they are actually derived from the single gene, both B48, that is a part of our chylomicron, and B100, that is shared by VLDL, IDL and LDL. Although they are the product of the same gene, but ultimately at the level of the transcription, after that, post that, due to RNA editing process, they are actually finally translated into different proteins, my dear friends. So this question was asked, I'm pretty sure about this, and the answer would be RNA editing, my dear friends. RNA editing, please try to understand, beta. RNA editing. Nimrat, yes beta, please try to understand. Yes, D, yes, RNA editing is the correct answer. For those of you who has got this answer correct, thank you all for getting this one right, my dear friends. We had discussed this only in selected batches in MIST, my dear friends. So please try to remember this question. RNA editing, this was one of the old question. It was once asked in the year 2016-17. I don't recall exactly currently right now, but it was an old question from FMG, and this was repeated this time again. So please try to remember this. RNA editing is the answer to this question, right? Waiting for this. Waiting for this option, beta. Waiting for this answer, beta. Oh, Benazir, Prashant, Ulfi, all of you are answering that it was also an RNA splicing. Yes, we could have got also for that answer, beta. We could have also got that. Yes. Now moving to the next question, beta. Next question. Yes, yes, this was an expected question. This was a different. Yes, my dear friends, all of you have got this answer correct, beta. All of you have answered this correct. Yes, the correct answer to this question is CRAO. CRAO. Crow. I had shouted multiple times during our classes, multiple times, under the lipid storage disorders. Under the lipid storage disorders, you all remember the mnemonic: cherry trees never grow tall in sand, right? C stands for CRAO. CRAO, right? All of you would have got this answer correct, my dear friends. Central retinal artery occlusion. You have this cherry red spot in macula. CRVO, you have actually tomato splash appearance. That is more of ophthalmology question, my dear friends. But during the lipid storage disorders or lysosomal storage disorder, we have seen this image in our biochemistry workbook of MIST, as well as I had told you this is an expected question and it has come. CRAO. Hope all of you would have got this. Yes, crow cherry cow. Kya baat hai? Kya baat hai? Yes. Moving further, my dear friends. Now, this is a tricky question. I had received multiple feedback about this question, and now I want your help to finally decide what was the exact question that was asked. There was a graph based question, beta. Particularly, they had given these four options: enzyme inhibition graph. Although we did not discuss much about the graph, but let us try to now find out the correct answer. Let us now try to find out the correct answer. I will just try to first find out. I am just asking for your help, beta, to first try to find out which graph actually they had given. If I number them like this is A, this is B, this is C, and this is D. I have just marked these graphs, beta. I am just waiting for the answers for this first. Okay, whether they have given A graph, B graph, C graph, or D graph, we are not sure. Many students has told me, sir, they had given this graph. Many students has told me, no, sir, they had given this. Few students told me they have given this as well. None of the students told me they had given this, so we can forget about the C. Confusion is between A, B and D. A, B and D. B graph, A graph, still confusion. B graph, A graph. B graph, B graph, B graph, my dear friends. Yes, most of them are telling actually for B graph. Most of you are telling about B graph. Please try to just let me just quickly summarize, beta. This B graph that you are seeing over here, beta, this is actually for the non-competitive inhibition, my dear friends. A graph is actually for the competitive type of inhibition. D graph that you are seeing is for the uncompetitive inhibition, and C graph is actually for the allosteric inhibition. So if B graph was given most commonly, then I would actually go for the answer as non-competitive inhibition. If B, if D was given, I would go with uncompetitive inhibition, my dear friends. So many of you are telling it is not A, not C. So competitive and allosteric ruled out. Confusion is between these two. If B is asked, let us try to remember the question. This was a graph of non-competitive inhibition. Okay, now the answer is also coming D. Oh my God. Again, confusion. Let us keep it as B, non-competitive inhibition. Try to focus here, beta. Please try to understand. Just point to be noted, in case of non-competitive inhibition, the meeting point or intersection of both this with inhibitor or without inhibitor, this will be actually not in the positive quadrant, always in the negative quadrant. Whereas in case of competitive, they basically meet on top of the y-axis, and here uncompetitive, they never ever meet. They never ever meet, my dear friends. Yeah, these are all does double reciprocal curve, beta. These are all double reciprocal ones, where we make that parabolic graph converted into, where we make the parabolic graph converted into straight line curve. This look at the graph. These are all straight liner, beta, है ना बेटा? ये सीधा सीधा line खींचा है हम लोगों ने, straight liner curve, all straight line, not that parabolic. Only thing that we have to remember here, that the parabolic graph has to be shifted to a straight line for better understanding. That graph or plot we plot, that we call it as double reciprocal plot. Lineweaver Burke double reciprocal plot. If this is asked, most commonly the answer will be non-competitive inhibition, बेटा. अगर A था तो competitive, D था तो uncompetitive. Most of you, bulk of the students has got B, so I will stick to the answer as non-competitive. Hope this question was answered correct by all of you. Now, this question, again, I'm not sure about the options, that exactly whether they did frame it like that, but the question was exactly like this. We are sure about the question, not sure about the options. Let us try to say that these were the options and now try to target this question, beta. Chanchal, you are giving the feedback for the question number 11 or question number 10, beta? Uh, Chanchal, Vashisht, Ilahi. Yeah, there was some question about some protein rich food or amino acid rich food, but no, not much of carbohydrate intake. And the question was actually asked like this, that why there is no increase in the insulin after that meal containing less carbohydrate or low carbohydrate or no carbohydrate but high amount of protein. Meal also, yes, Archit, they have asked about meal. I believe these two are correct, beta. These 2 points, protein rich food was mentioned, this was there, and definitely they would have mentioned about low carbohydrate or limited carbohydrate, low carb or no carb, something like that would have been mentioned, right, beta? Language of the question was completely different, my dear friends. Insulin work is minimized when there is rise in amino acid. Different question, different option, beta. So I will just wait for your feedback in the chat box or in the description section, beta. Maybe you can, if somebody recalls that exact options of this question, then we can actually come to end. Amino acid ज़्यादा था. Yes, Chanchal, that part we have understood that it was protein rich food or amino acid was high. Amino acid was high. Yeah, these two essence I had got. Amino acid high and carbohydrate was low. One option, glucagon will be secreted after meal. No, the question, why was there no hypoglycemia? See, just let me just help you to quickly understand. Multiple feedbacks are coming. I will just look at this once the live session is over and I will try to reframe the question as per your collective feedback. But for the time being, just try to know for your knowledge sake, beta, how do we try to target this sort of question? No matter whatever way it has been asked, we have to remember that what is the job of this insulin? What is the job of this insulin? Try to focus here. Please remember, insulin, my dear friends, it is actually an anabolic hormone. Insulin, my dear friends, is actually an anabolic hormone. And why it is called as an anabolic hormone? Please try to understand that it increases carbohydrate synthesis in the form of glycogenesis. In the form of glycogenesis. Second one, please try to understand it also increases protein synthesis, and also try to understand it increases fats synthesis or lipid synthesis. Carbohydrate synthesis in the form of glycogen, beta, in the form of glycogenesis, carbohydrate increase, protein synthesis, fat synthesis. However, at the same time, it also increases glycolysis as an catabolic function. Glycolysis as a catabolic function. So this is just for your knowledge. I'm not marking any correct options over here, beta, because as I'm now receiving multiple feedbacks that hypoglycemia not will be seen. Hypoglycemia, high amino acid diet where there is, yeah, please try to understand. Now we are going toward the essence of the question, getting the feedback. So you are seeing three things that protein will do positive. That is, increase carbohydrate synthesis in the form of glycogenesis, protein synthesis increased, fat synthesis also increased, and glycolysis at the same time also increased. Now, the patient had consumed amino acid rich diet or protein rich diet, hai na? And carbohydrate was low. Now, please try to understand, carbohydrate has to be there in the postprandial state so that insulin has to secrete or insulin has to rise in our blood, because it is doing two functions related to carbohydrate. One, it is breaking the glucose. After the glucose has been uptaken by the peripheral tissues, then it will break down the glucose by increasing glycolysis. This is glucose breakdown, and whatever glucose will be extra, that will not be wasted and it will be converted to glycogen. So we are trying to see over here, beta, that carbohydrate rich meal will trigger insulin. Insulin will further take out glucose out of the blood and throw it to the peripheral tissue so that they will undergo glycolysis. So glucose is taken out of the blood by insulin once we have this carbohydrate rich diet. But in case of protein rich diet, please try to understand, already you are getting amount of protein. Protein synthesis is not required much further because you are already getting amount of protein. So that might be the way they had asked about why there is no hypoglycemia seen after consumption of high amino acid or high protein rich diet, beta. Yes, some receptors, yes, does not attach to its receptor in presence of high amino acid. Yes, Aman Khan, Aman, yes, this might be one of the options and this might be the correct answer as well. One option, Aman is telling that insulin does not attach to its receptors in the presence of high amino acid. Yes, this might be one of the correct answers. Amino acid diet high, don't have hypoglycemia. Yes, because amino acid that are taken, amino acid rich food, pathway will be more diverted towards this protein synthesis pathway. Glucose has not come, carbohydrate has not come, so no need of this increased glycolysis because there is no carbohydrate. So please try to understand, protein rich diet, the insulin's main function to carbohydrate, that is to remove glucose and cause hypoglycemia, will not be seen much because the pathway will be diverted more towards protein synthesis. You are giving high amino acids, high amino acids will be channelized for protein synthesis, others will be decreasing. So something like that, something like that. Yes, this was the question. This was the question. Akib, yes. Yes, that's what we mark. Great, beta. Great, beta. Great. Thank you for your honest feedback, beta. Really appreciate to come out with the correct answer. Really appreciate. So, that insulin binding to its receptor will be decreased in presence of high amino acids. Yes, in presence of high amino acid, right? Important point to be noted, beta. Hope you all would have got this answer correct. So please try to understand, high amino acid rich food, we don't have much of carbohydrate, don't require much of role of insulin. Insulin doesn't have to throw glucose to the tissues, no need to bind to its receptor. That most likely is the correct answer. So let me clap for all of you, beta. Now going to the next question. Going to the next question, beta. I hope we have kept this. I hope we have kept this essence correct. Question, beta. Yes. Multiple students has told me, please don't say that this was not the options. I believe these were the options. Yeah, beta, yes, beta. I hope I have just cooked up some stories, but the main crux was these words: COVID patient, excessive multivitamin supplementation, nerve sensation, tingling sensation, maybe position vibration sense was also mentioned, something like this. They have asked about, yes, yes, Sheikh Anil, Zafar, Benasir, all of you. Yes, beta, you have answered this question correct. This is vitamin B6 toxicity. We had discussed in our classes as well that vitamin B6 is the only water soluble vitamin with a significant toxicity. Only water soluble vitamin. In the list of water soluble vitamin, they do not actually cause much of toxicity. This was a question on excess, hypervitaminosis, toxicity, not deficiency, beta. Sometimes nerve sensation, tingling sensation you might get in B12 deficiency, subacute combined degeneration. But this time they had asked about question on hypervitaminosis. Please try to understand, my dear friends. Hypervitaminosis B6, and the name of this toxicity is called as peripheral sensory neuropathy. Basically sensory neuropathy. Please try to understand sensory neuropathy, my dear friends. We had discussed this. This is the only water soluble vitamin with a significant toxicity, sensory neuropathy, peripherally classically seen. So tingling sensation can also be seen in B6 excess. Please remember, beta, tingling sensation is a common finding. B1 deficiency, B12 deficiency, B6 excess. Repeating one more time: B1 deficiency, B12 deficiency, B6 excess. Two deficiencies, one excess. Answer is B6 excess over here, right? No, beta. No, Jacob. No, beta. No, no. B12 is not the answer. This is not the answer, beta. B12 excess will not cause this. It is B6 excess that is going to cause peripheral sensory neuropathy. Only water soluble vitamin that can cause toxicity. Answer is B6 excess. B6 excess. Yes, right. Hope you have got this question. I'm writing this word: only water soluble vitamin with significant toxicity. With significant toxicity. Important point. Answer will be B6 excess. Right. Not B12. B12 deficiency might have those features, but here the patient was taking multivitamin supplementation, na? Already giving B complex more. Right. So B6 excess we have to consider over here. I believe they would have used any of these two words. I believe they would have used any of these two words, beta. Yes, xerophthalmia or conjunctival xerosis. Few students told xerosis or few students told xerophthalmia. In any case, close your eyes, and I hope all of you would have got this answer correct. That is vitamin A, beta. All of you would have got this question directly answered, vitamin A. Moving to the next question. Repeat question. Repeat question. Repeat question. Most likely 2021 June FMG exam. Repeat question. Question number 14 beta. Yes, from last session, all of you have got this answer correct, beta. Galactosemia. Galactosemia, right? This is actually also an overlapping question with community medicine as well. But in our class, we had discussed, this was also asked earlier, galactosemia, you never ever give breastfeeding. HIV, hepatitis B, CMV infection in the mother, we can give. In modern countries like in India, even HIV infection, HIV infected mother can also breastfeed the child. But galactosemia is the answer of this question. We have discussed this. This is a repeat question, but it is a repeat question, and I believe all of you would have got this answer correct. All of you would have got this answer correct. Please remember, HIV, in modern countries like in India, we do breastfeed even for HIV infected mother. Please try to understand. Now, moving to the next question. Only a handful of students actually had come up out with this beta, but I believe strongly that this question was asked. Tough question. Tough question. This question was asked. Tough question. Waiting for the answer to the question number 15 beta. Question number 15. Focusing on this beta. Question number 15. Yes, Aman, many repeat questions were there. Many repeat questions were there. Yes, waiting for the answers 15. Waiting for the answer beta. Yeah. Waiting for the answer. Yeah, something like this. Following essential amino acid. Many students has confirmed me this beta. Many students had confirmed me this. They did use this word essential amino acid that can prevent the cardiac problems. Essential amino acid that can prevent the cardiac problem. Yes, my dear friends, Vidya, you have answered this correctly beta. The answer to this question is leucine. Yes, my dear friends, I believe leucine was given as the option in the list of essential amino acid. Please try to understand. Few students has told me it was just amino acid, but few students has also confirmed okay, no sir, they had mentioned the word essential as well. If they have mentioned the word essential, definitely they would have given in the option leucine. Please try to understand, my dear friends. Try to focus here beta. All of these four names that you are hearing is actually essential amino acid. If I ask about this cardiac problem prevention, then the best answer to this question will be actually glycine. Then we also can have something called as taurine, and we can also have something leucine. What I am trying to make you understand the order of importance better. Most important, cardiac problem, glycine. Second, taurine. Third is leucine. Third is leucine, my dear friends. So if leucine is there in the option, glycine is not a non-essential amino acid. This is not an essential. Taurine is the modified one obtained from the cysteine to taurine. Leucine is the direct question, prevent cardiac problems. So please try to understand beta. Try to focus it beta. Yeah, many of you are telling that this is not the question, but actually there was many students who has given me feedback that they asked about essential amino acid that can prevent the cardiac problem, that can prevent the cardiac problem, my dear friends. Glycine, I believe, was not there in the option because this is non-essential. Taurine, I believe, also was not there. Leucine, please try to understand, they basically prevent TAG deposition. They basically prevent triglyceride deposition, right, my dear friends? So please try to understand. Oh, now many of you are telling that Not much of this was there, but if at all this question was there, so please try to hope that you would have marked this answer as leucine. Moving to the next question, beta. Moving to the next question. I am pretty sure this question was there. I'm pretty sure this question was there, beta. So let us try to target this question. Let us try to target this question, beta. Yeah, essential fatty acid question we will come. That is there. That is a different question, beta. Yeah, omega 3, omega 6, omega 9 we will come. We will discuss. That we have already. Yes. Now the answers is coming. Yes. Yes, Bhumika. Thank you. Amritansh. Thank you, beta. Yes. So I believe all of you would have. Yes, beta. I hope all of you would have got this. This is the answer to this question is the option A, that is accumulation of sorbitol and fructose. We had discussed this. Please try to understand under the topic of polyol pathway. Polyol or sorbitol pathway in the fructose metabolism. After that, we had also talked about this pathway is the one which basically converts glucose to fructose as an intermediate of sorbitol, and this sorbitol is the main reason for getting deposited in the lens, and it will cause something called as snowflake cataract, also known as diabetic cataract. So there might be deposition of both. I believe this was the exact two that you all would have marked this answer. Yes, thank you, Avinav. Thank you for your feedback. Accumulation of galactose, glucose, no. This is the answer, sorbitol plus fructose. Sorbitol being an hygroscopic compound, it is also predominant for causing the cataract. Moving to the question, beta. Yes, this question was pretty sure was there. Direct question, beta. Yes, Shibham, thank you. Yes, it was there. Actually, all based on your feedback, beta. Sometimes it's difficult for the students to recall everything with the options, but we sincerely clap for their sincere efforts with coming out with the essence. That's why we are able to discuss. Yes, all of you. Sarfaraj, Amritansh, Vidya, all of you would have got this answer correct. This is straightforward calcium. Please try to understand, my dear friends. Copper, chromium, iodine, all three are micro. Micro. Question is not a micro. Calcium. Calcium, my dear friends, you all would have got this answer correct. I'm pretty sure about all of you. Calcium, it is a macronutrient. Macronutrient, right, beta? Macronutrient. Let us try to see this one more time, beta. Just trying to quickly show you up here, beta. Important, we are focusing on these micronutrients and the macronutrients. Please try to understand macro minerals and the trace minerals. Macro minerals, calcium, my dear friends, is there in the macro minerals. Trace minerals we have seen in the option chromium, copper, iodine. Chromium, copper, iodine, these three were there most likely in the options, and all of them are trace elements, whereas this is macro minerals, right? Important point. Hope all of you would have got this answer correct. Answer to this question was calcium, my dear friends. Now moving to the next question. Next question. Many of you were answering about those pellagra, maize diet. This is the question. Now I have got the feedback that this was basically asked as a clinical type question, so I have added some clinical history. Maybe the history was little bit different than this one, but essence is again same. Okay, selenium was also there in the option. Anyhow, it will be also a micro one, so calcium remains the answer. Yes, this is a straightforward question, beta. Straightforward question. Yes, Shivam, Rafikur, Medicolic. Yes, beta. I hope all of you would have got this answer correct, beta. All of you would have got this answer correct. Waiting for the answers, beta. Waiting for the answers. Four D's were mentioned. Okay, my dear friends, straightforward they had asked. Okay, 4D, 4D. Dermatitis, first one. Diarrhea, second one. Dementia, third one. If not treated, D, last one. Death. Kahani khatam. Please try to understand, my dear friends. I had framed it like this. Maize-rich diet, important point to be noted. Neck region, rashes. Castle's necklace, dermatitis starts over there. There is diarrhea, dementia, recent forgetfulness. If they would have given 4Ds, then obviously the answer straightforward will be vitamin B3. No confusion asked over here, beta. Yes, prepared 4D. Yes, moving to this question. Right. Yes, this question was also asked. Try to recall. Yes, this question was there. 300 MCQ. Sometimes it's difficult to recall. But yes, this was asked, my dear friends. Okay, niacin was there in the option and they had used the word dermatitis dementia. Then so it is like just like a cakewalk. Okay, they had given that sort of easy, straightforward. Okay. Yes, I believe this question was also asked. Yes, Amruta, Benasir, Ayana, Pavan, Ronit, Shive. Okay, isolated dehydrogenase was also there in the one of the option. Noted, beta. Noted, Mohammed. Thank you. But the answer to this question, my dear friend, is cytochrome C oxidase. Cytochrome C oxidase, beta. Cytochrome. SOD was there also in the option. Superoxide dismutase. Superoxide dismutase. Please try to understand. Yes, beta. Isocitrate dehydrogenase. SOD, super oxide dismutase. These two options we have got, and obviously cytochrome C oxidase. See, what is the question? See, actually there is a little bit confusion in this question. Few students told me that enzyme that utilizes water but produces oxygen. Please try to understand, beta. Utilization water and byproduct oxygen, this sort of enzymes are very rare in biochemistry. Rather, I believe the question would have been asked as that incorporates molecular oxygen, uses oxygen and produces water. Uses oxygen and produces water. If you remember the electron transport chain, beta, in the complex number 4, we have got cytochrome C oxidase that basically utilizes half of O2 and two hydrogens, and ultimately it is produces one molecule of water, right? If you recall this, beta, in the last step of the electron transport chain, we have utilization of half of O2 plus two hydrogen to produce one molecule of water. So cytochrome C oxidase. Another one, I hope that they did not ask about monooxygenase. Please try to understand, beta. Monooxygenase group of enzyme, like also those hydroxylase, they also actually can participate in this sort of reactions, my dear friends. Please try to understand. We had discussed during our classes at MIST that AH plus O2 plus B. Please try to understand, beta. This we have to understand. One O can actually be H. Please try to understand. This actually can also form AOH, oxygen we are utilizing, and the byproduct can also be water as well as it can be B. So trying to focus on this reaction here, my dear friends. Trying to understand this over here, my dear friends, that utilization of the oxygen and the byproduct generation of water, it can also be seen by the monooxygenases or hydroxylases. Even they can participate this. I hope this monooxygenase or hydroxylase word was not used in the options and they had given cytochrome C oxidase. Then if you have marked the cytochrome C oxidase as the answer, then it would have been correct, my dear friends. There are two such reactions. Utilize oxygen, produces water. One is oxidases, cytochrome C oxidase. Another one is monooxygenase or hydroxylase. Yes, which enzyme will use oxygen and byproduct is water. So many students has confirmed me this, beta, that utilizes oxygen but produces water. See, both of them. Utilizing oxygen produces water, utilizing oxygen produces water. Any of these could have been marked, but I believe hydroxylase or monooxygenase word was not mentioned in yesterday's MCQ, right? Hope this is clear to all of you, beta. Accept, it was which accept hydrogen as oxygen. No, beta, no. The word, I think you are, Pawan, I think you are making some mistake over here. Uh, which accept hydrogen as oxygen, no, beta. Acceptor of hydrogen, superoxide dismutase, no, beta. Superoxide dismutase, isolated dehydrogenase, none of their mode of action is actually following this. I believe they would have given this, beta. Oxygen utilization and water production. Right. So this is the question, beta. Please try to understand. This is the hydrolase, different type of action that few students has given me feedback that they had utilized water, produces oxygen, but there are no such reaction like this, beta. Maybe they can utilize water, produces hydroxyl group, something like that. And the remaining this reaction that you are seeing, cytochrome oxidase, utilizes oxygen and produces water. So this question I believe was asked in this format. This question straightforward. Hope all of you would have got this one correct, beta. Hope all of you would have got this one correct, beta. Hope all of you would have got this one correct, beta. Yes, Aman, the exam few questions were tricky, although students are giving feedback that it was pretty easy, but some punch was there, beta. Some punch obviously will be there. They cannot ask all flat questions from one subject. Obviously they will be asking some tricky questions up their sleeves as well, right? Yes. This question I believe was asked. So thumbs up from all of your side. Nitric oxide, direct question, arginine. We had discussed this question that particularly. Please try to understand arginine will be giving rise to arginine, nitric oxide, my dear friends. This is NOS. We had all discussed about NOS, all those things 1, 2, and 3. We know everything about NOS. Even they would have asked tough question, you guys would have definitely solved it, my dear friends. Yes, biochemistry was more or less easy, beta. So I believe all of you would have got this one. Nitric oxide derived. Few students actually had told me about this. Only a handful of students had come up with this type of MCQs with this type of options. Please have a look, beta. Waiting for this, beta. I hope that this way the MCQs was asked. Yes, okay, correct recall. क्या बात है, क्या बात है. Great, my dear friends. All of you have answered this question correctly as well. Great. Vitamin C and copper. क्या बात है. क्या बात. We have tried, beta. We have tried. In just one half day session, we have tried to come up with as much as close to as much as original possible, my dear friends. Right. So basically, they have asked it about the collagen, and we all know collagen synthesis is particularly dependent on these two. If you talk about hydroxylation, for which deficiency there is scurvy, vitamin C is needed, and lysyl oxidase, that is collagen cross linking, oxidative deamination, for which deficiency we have Menkes kinky hair disease, that is associated with copper. So these two are very much needed. One is for collagen maturation, another one is for the collagen quaternary structure, that is collagen cross linking or collagen fibril formation. I hope all of you would have got this answer correct, my dear friends. Kya baat hai. All of you would have got this answer correct. I think this question was also there, one liner, although we did not discuss about this in our class, but there it was mentioned clearly in our handouts of workbook biochemistry. In biochemistry workbook, vitamin chapters was given separately, and there it was clearly mentioned that. Hope this is clear too. Yes, I believe Ravi, this question was there. Ravi, this question was there, sure, it was there, right? Many students has given me feedback. Yes, yes, thank you, thank you, thank you. This was there in our notes as well. Due to shortage of time, we did not discuss this in our class, but I had just verbally mentioned. But during the workbook, it was already pre-written in our enzyme, in our vitamin section as well. Yes, answer to this question, vitamin K inhibition, my dear friends, dicumarol. This is again a repeat question, beta. Repeat question from recent. Yes. Yes, thank you, beta. So we have tried, and unfortunately, due to shortage of time and to give you the glimpse as early as possible, I also received some feedback about these sort of, statements, but I'm not sure. Not sure about. I could not frame any question because due to lack of info. So at least 22 questions were asked from biochemistry this time, straightforward. Yes, so it was there, beta. Dicumeral question was clearly there. Yes, the answer to the last question was B, beta, vitamin K inhibition. Thank you for your here. Yes, this question was asked. Almost all the questions that we have shown in today's live session was all asked. Maybe little bit tweaks, options like that insulin question, receptor. I got to know. Thank you for your feedback. I will incorporate that. Right. 25 is there. What is 25, beta? Beta, Dr. Dopamine and yes, something. Can you just share some info regarding this 25 beta? Actually, these are the feedback that I have received, that there was in the option there was something NADH, NADPH, something like that. But how do we frame? How do we frame? 26 was also there. Okay, great. 26 question was also there, but I believe it was more tuned towards pharmacology. So I think it will be taken by our pharmacology, sir. So I'm not going into the green. But what about this 23, 24? 24 was there, vitamin B9 deficiency. Avinav, if you just can share the questionnaire, beta, how it was asked. How it was asked. Okay, 24 was also asked. Oh my god, all of them. This time, so many questions from biochemistry. Kya baat hai? Okay, 26 PPAR gamma. PPAR gamma, that question, that will be mainly pharmacology. So I'm not going into that. So I am not going into that. 26, it will be a pharma question, beta. This will be a pharma question. So pharma teacher will be asking you regarding that. But what about 23, 24, 25, beta? Yes, pharma question. Yes, pharma question. PPR gamma means it is pharma question. Straightforward. Also the option gem fibrozil rosuvastatin they had asked. 24 B12 deficiency. Okay, so they did ask about B6 excess wala question as well as B12 deficiency as well. So okay, so they had asked about question on B12 deficiency and they gave a clinical history. Was it a clinical history type question, beta? Subacute combined degeneration, position sense, Romberg sign positive, Babinski sign positive, dorsal column tract or pyramidal tract, some features, upper motor neuron, lower motor neuron lesions, something like that was there in this question number 24. Asking about question number 24, beta. हाँ, vitamin toxicity अर्चित we have already discussed, that is B6 excess. उसको हो गया, उसको भूल जाओ अभी. Now try to focus on this B12 deficiency वाला question. Many of you are telling that B12 deficiency was there, but what was the question, beta? How did they frame? Was it clinical type? So many questions were there from vitamins. So many questions. We had all discussed this, beta, in our mock test and discussion sessions, golden facts. We had discussed this. No, Anand, that toxicity question is different. That is B6 excess. वो तो हो गया. That is done. That is done. Okay, so vegan, very chronic alcoholism. Okay, maybe we are not able to recall that question. Anyhow, we have recalled 22, 23 question. Really hats off to you guys, but really hats off to you guys. I anticipated there will be at least 20 questions, but 23 questions we can easily point it out. What about 23, beta? And 25? What about this 25? Just I will take one more minute from your side to just come to this. Anybody can share something about 25? Rakshita. Rakshita, yes, 25. What was the question, beta? Rakshita, Jacob, Honey, complex one. Okay, let me write it here, beta. Complex one. What was the question on complex one? I mean, which of the following enters into electron transport chain through complex one? Then the answer will be NADH plus H plus beta. Yes, this enters into ETC through the complex one. Was it this question? Was it like this, beta? Yeah, cytochrome P450. Cytochrome P450. Okay, dopamine. Thank you, thank you. Anyhow, we have got to know P450. Okay, cytochrome P450. Let me just write. I will wait for the feedbacks in the upcoming days as well, so that we can finally frame all the remaining missed out questions. Yes, P450, P450. Okay, I will try to think what ways they can also. I will also do brainstorming so that you guys can also help me. All of you have my number better, so that is not a problem. So, and this question 23 was not asked, right? B6 deficiency. I think this question was not asked. 23 was not asked, right? So finally, just one more minute, better. 23 question was there or not there? So 22, 23, 24. 24 questions that was asked from biochemistry as of now. 24 questions. 26 will go to pharma. What about this 23? B1 question, very. B1 deficiency. Okay, so this is B1 deficiency. Okay, and they asked about very as well. Okay, okay. Okay, Sushmita, yeah, 25 we have got the idea. P450 complex 1, it is a related question. Okay, very, Aman, very won't be seen. Let me just write it here quickly. Very won't be seen. Very won't be seen in vegan, chronic alcoholism, chronic renal failure, CRF. Won't be seen in. Okay. Bariatric surgery also. Okay. So these are the options. B1 deficiency or B12 deficiency? क्या पूछा क्या था? Okay, you are answering for the B12 deficiency wala question. Okay, got it. B12 deficiency in deficiency seen. Okay. Anyhow, we have got to more or less we have reached the target that around 24 questions were asked from biochemistry beta. Yes. So hope you have got this one correct beta. Bariatric surgery if 23, then this question, yeah, that is the other option. Option bariatric surgery I have written. I will just do brainstorming and see maybe how the question would have been framed. So four options, all of you we have got. B1 deficiency. B very won't be seen in person taking diuretic. Okay. Bariatric surgery. Rahul, yes, thank you, beta. Vegan, alcoholic, bariatric surgery, and also the CRF, chronic renal failure, was also there in the option, right, beta? So I believe all of you would have done your best. Now wait for the great results. The upcoming faculties from our side also will be sharing their thoughts as well as the question. So thank you all for giving me a patient hearing, and thank you for joining in such short notice, my dear friends. And now just let us wait for the great results in just a month's time, beta. I'm sure that all of you will be coming out with flying colors. Hats off to all of you. I believe you would have definitely marked enough right in paper one, so that ultimately, cumulatively, all of you will be crossing 150 for sure, my dear friends. Right. Thank you so much. Thank you so much for your patient hearing, and wish you all the best, my dear friends, for great results once they are out. Right. Thank you all. Please do contact me once the results are out. Now please have the upcoming sessions and try to enjoy the missed journey as well. Thank you all, and once again signing off by wishing you all the very best. All the very best. Thank you, beta.